Okay, it's noon by our clocks here, so we're going to go ahead and get started with today's webinar. My name is Brooks Ballard, and I'm with the Michael and Susan Dell Center for Healthy Living here at the UT School of Public Health Austin Regional Campus. We're very delighted to be hosting today's webinar. I just want to run you through a little bit of housekeeping before we get started. First thing is, we do encourage your questions today. We would love to hear what you want to know about, but I'll answer the most popular question, which is yes, we are recording this webinar. An archive will be posted on the msdcenter.org website at the end, probably later this week. You'll also get an email with a link to the archive 24 hours after this webinar is over. With that, I'd like to hand it over to Courtney, Dr. Bird-Williams, who will introduce our speaker today.
Hi, thank you, Brooks. Thanks again for joining our webinar today. My name is Courtney Bird-Williams. I'm an assistant professor in the Michael and Susan Dell Center for Healthy Living at the UT School of Public Health. Today, I am delighted to introduce Julie Stagg, the State Breastfeeding Coordinator at Texas Department of State Health Services. Julie and her team at DSHS developed the Texas Mother-Friendly Worksite program to encourage and recognize employers across the state who have policies and practices in place to support worksite lactation. And to date, over 2,000 worksites have been designated. Recently, we at the Michael and Susan Dell Center for Healthy Living have joined the Texas Mother-Friendly Worksite team, and we are excited to be providing technical assistance and support to employers who would like to become designated. And now I will turn it over to Julie Stagg.
Thank you, Courtney, and thank y'all for joining us today. This is our third webinar in the past couple of months to provide information to employers about becoming a mother-friendly worksite, and this particular webinar is about maximizing return on investment. So going beyond minimum standards and creating a comprehensive program of breastfeeding support. As a refresher, well, first of all, let me provide you with some information about how to get in touch with us. As Courtney says, technical assistance is available to employers who are working on developing worksite lactation programs and policies, and you can reach us by emailing us at info@texasmotherfriendly.org. We will be covering today best practices for a high return, sustainable worksite lactation support program, talking about ideas for leveraging existing resources to build a comprehensive program package at a low cost, and also touching on some ways that you can incorporate not just your female employees in these benefit packages, but also your male employees. So to provide some background information so that we all can start on the same page, I want to talk a little bit about why worksite lactation support programs are so important and why breastfeeding is important. There have been two recent cost analyses that show how increasing rates of any and exclusive breastfeeding in the United States could save quite a bit of money and also impact health outcomes in a really substantial way. So one of these cost impact studies looked at the pediatric costs of breastfeeding rates being lower than what they could be. And if we could increase our current breastfeeding rates to having 90% of infants exclusively breastfed through the first 6 months, it's estimated that over $13 billion would be saved per year in the United States in health-related expenses, both direct and indirect expenses, and almost 1,000 infant lives would be saved per year through reduction of disease and disability. This is the reference for that cost analysis. And a second cost analysis looked at the cost impact of breastfeeding on mother's health, or rather the impact of suboptimal breastfeeding for moms. So if we could increase current rates of breastfeeding so that 90% of women were breastfeeding for at least a year after their child's birth, which is the recommended minimum duration, then over $17 billion in direct and indirect medical costs would be saved each year, and about 4,400 premature deaths could be prevented among women, and this is related to cardiovascular disease and breast cancer and other poor health outcomes. And this is the citation for the maternal health cost analysis. So the good news is that most women do choose to breastfeed, and we have data that demonstrates that most women are not able to meet their personal breastfeeding goals. So women could breastfeed longer with appropriate support. So what do families want or need in order to meet their breastfeeding goals? There's some basic supports that should be in place to facilitate this. The first is having enough time after delivery so that a milk supply can be established. Mother and baby can bond and get into a rhythm of milk production and a feeding pattern. And the minimum recommended time for leave after giving birth is 6 weeks, and 16 weeks is recommended. There's health studies that show that if 16 weeks of time were taken by most women, that the rates of breastfeeding would increase sufficiently to prevent about 1 neonatal death per 1,000 live births. Another thing that mothers need after giving birth is direct access to their baby, again, in order to be able to establish milk supply and a feeding rhythm. They also need to know how to breastfeed and how to overcome any barriers that they encounter as they're establishing breastfeeding. And a lot of that information can come from other moms. So mother-to-mother support is really important, both to pass on information about how to navigate barriers or deal with everyday issues related to child rearing and to breastfeeding, but also to give mothers the encouragement that they need to address those barriers even when things seem hard. Sometimes moms need professional lactation support from a lactation expert, like an international board certified lactation consultant. And particularly for working mothers, it's helpful to have information about how to combine working and breastfeeding. So one way that this can be provided is through a back to work consultation. After the baby is born, before the mother returns to work, just talk with her about coming back to work and how to combine working and breastfeeding. Moms also need basic support in their day-to-day lives. So whether that is the ability to go about their business and combine breastfeeding with their daily lives, like going out in public and being able to have a safe place to breastfeed their baby. And then when they return to work, having the basic support from managers and coworkers so that they know that everybody's on board with them meeting their basic needs. They also need, when they're separated from their babies, time to express milk or to pump milk. And when they return to work, this is usually every 2 to 3 hours for 15 to 20 minutes at a time, although the frequency and the time needed might vary. And they also need a private, comfortable space in order to express milk or to directly breastfeed their babies. So the basics, to recap, are just to have time, space, education, and support, or you can use this acronym STEP, support, time, education, and place. Businesses that have a comprehensive worksite lactation support program in place have seen return on investment of $2 for every $1 invested, or even higher. Some report $3 for every $1 invested. The way that this return is experienced is through reduced health costs to businesses, lower absenteeism, so one-day absences occur twice as often for employees whose babies are not breastfed than for employees whose babies are breastfed. And absenteeism rates are also lower for male employees when their female partners are breastfeeding. So that's why this is, it's important to include male employees when you're planning your worksite lactation programs. Businesses often include male employees by having prenatal education classes or arranging for those or referring those to those where the male employees and their partners can attend. They might have classes specifically for dads and to help them be prepared to support their partners with breastfeeding. They might have benefits like providing breast pumps to a male employee's female partners and other types of benefits along these lines. So breaks are predictable and absences are not. So it's easier for employers to plan around set breaks that they've negotiated with their employees that meet both the employees' needs and the business's needs than to deal with unanticipated absences. So workflow can be arranged to meet the needs consistently. If employees are absent due to sick children, then that's lost work time. Another factor that contributes to return on investment is decreased presenteeism. And presenteeism means that a worker is physically present at the workplace but is functionally absent. So they might be overtired, stressed, fatigued, sick, or distracted by other obligations. So when an employee's needs are met through having a worksite lactation program, they can be fully present in their jobs. Another huge cost for employers is turnover. The average retention rate after a mother gives birth in the United States is 59%. Companies with lactation programs have reported a retention rate of greater than 90%. Turnover is costly because the replacement cost for most employees is up to 1.5 times as high as the salary for that current employee. And this doesn't include costs such as lost institutional knowledge, the time needed to bring somebody up to skill, etc. So it is much easier for an employer to retain existing employees than to retrain a new employee. Another benefit to employers of having a worksite lactation support program is having employees reporting feeling more productive and loyal to the company. They appreciate the investment that you've made in them, and they are feel at ease and have a clear mind to be able to focus on their job, and they have a great deal of gratitude and loyalty to companies that appreciate the balance of their work and their personal life. Worksite lactation support programs are also a great recruitment tool. And employers are always looking for competitive employees, and that includes women of childbearing age and male employees that might have anticipation of having a baby in their future. So having a program like this shows that you will respect that work-life balance and makes you a more appealing employer. There's also, again, a legal basis for having worksite lactation support programs. I'm not going to spend a lot of time on this, but there is the Federal Fair Labor Standard Act that requires employers to provide some basic supports. There's also some guidance from the Equal Employee Opportunity Commission in the Pregnancy Discrimination Amendment of the Civil Rights Act. And in Texas, for public employers, there's now Texas Government Code Chapter 619, the right to express breast milk in the workplace. So employers that have worksite lactation support policies in place and programs in place can receive recognition through the Texas Mother Friendly Worksite program. To be designated as a Texas Mother Friendly Worksite, a worksite has to maintain a written policy that's communicated to their employees, and that policy should adhere to the definition of a mother-friendly business, provide work schedule and work pattern flexibility, to accommodate time for an employee to express breast milk during her workday for her child's first year or longer, provide a private accessible area other than a bathroom that's functional for the use of milk expression, shielded from view and free from intrusion from coworkers, provide access to a clean, safe water source and a sink, and access to a hygienic place to store expressed breast milk. So again, that's a private place, not a bathroom, unless it used to be a bathroom and it isn't anymore. This space is a bathroom where the toilet has been removed, a cap was placed on the floor, and the space was converted to a lactation space. And it's perfect because it's just the right amount of space for what's needed, and there's already a sink in place, so that's a bonus for moms who use that. This sign, if there's not a lock on the door, a sign is important to ensure that the room is free from view and intrusion of the public and coworkers. The space doesn't have to be a dedicated space. There are a lot of flexible options. This is one option with curtains. This is a partition that can be used in a larger multi-purpose room. Cubicles can be installed. This is several pumping stations in a row in an unused corner. This is another example of using a partition. For large businesses, a multi-user space might be recommended, and this is a space that's been simply divided with a curtain to allow more than one user at a time. This is actually in Texas. This is the Walmart in Palestine, Texas. They've converted one of their dressing rooms into a lactation space. This is a conference room that can be used when needed as a lactation space. An exam or patient room can be an appropriate space. A manager's office, if nowhere else is available, a manager's office can be used. Space can be converted in a locker or a shower room as long as the room is clean and dry and there's not an active shower within the space. So this is a corner of a locker room that's been converted using cubicle walls. And this is a part of a shower room that's been partitioned off, where the sink part of the shower room has been walled off and can now be used as a lactation space. This is a converted closet, so even a broom closet is large enough. Obviously the lighting and the things that were stored in there previously have been changed so that it's a nice, comfortable space. This is an example for an outdoor setting. This was actually a new porta potty that was converted to become a lactation space. They took out all the toilet installment before it was ever used and made a lactation room, and it's just big enough for what's needed. And you can use battery powered pumps or provide a converter battery for use for a plug-in pump. For folks that work out in a field, a vehicle might be appropriate if there's screening available. For emergency workers, the back of an ambulance is a great space with climate controlled and privacy built in. Agricultural workers in California use a pop-up tent, and again a battery powered or battery converter pack for their pump. This is the tent and the mother's storage. This is a tent in an office setting, and this mother uses this right next to her cubicle space. A storage area when there's no other options can work, and there's signage here, and that's the pump space. The chair is used as a table for the mother's own pump. And a shared space, if there's several businesses that are in close proximity to each other, a shared space can work well. This building in New York has a space that's shared by all of the buildings within a close proximity to each other. So proximity does matter. If the mother has to walk further than 5 minutes, it's probably too far for her. So even in a large campus or large building, that's a good thing to think about. I'm thinking specifically of hospitals with multiple wings or floors. If you only have one lactation space in that building and it's off of a main hall and, you know, kind of tucked away, that might not be convenient for staff to be able to access, and you might need to think of some other options. The National Institutes of Health have come up with this formula that they use when calculating how many spaces they need in their settings for dedicated spaces. And if you have only a few employees, a dedicated space might not make the most sense. You can use one of the flexible space options. So inside of that lactation space, there's just some basic things that are needed. A chair and a flat surface that's comfortable and suitable for the purpose of milk expression. Having signage, again, to ensure privacy. And an electrical outlet, whenever possible, is very useful. This was installed into that dressing room that I showed you earlier in the Walmart, and this was under $100 to install this electric outlet here. Storage alternatives don't have to be in the lactation space, and there are many options. A shared refrigerator space is appropriate, or a dedicated refrigerator space, or mom's own coolers.
What's that?
Moms prefer.
Did you hear something on this?
The sink, as I mentioned, is required that there's a sink and a clean water source, but that can be either in the lactation space, in a break room, in a bathroom. It could be outside, and if there's no running water, as I've mentioned in previous webinars, it could be just a cooler or some other kind of clean water source and a wash bin. Time is also a requirement, and time can include flexible break times combined with existing breaks. So using a mother's existing breaks during her workday at a time that's convenient for her, that's appropriate for her and her needs as a nursing employee. And then having the ability to make up any extra time by coming in earlier, staying a little later. The law only requires that breaks be provided, and it doesn't require that breaks be paid. Mother-friendly worksite designation also doesn't require paid breaks as long as there's time to make up the breaks with flexible scheduling options. Some moms will choose to take a shorter meal break or eat while they work to conserve time, and some women will even pump during meal breaks or while they work. However, employees should not expect or require women to work while expressing milk. If she is working while she's expressing milk, that's not a break technically. and some women will choose to do that, but women should also have the option to take a break to be able to mentally disengage from work and relax enough for milk to flow efficiently. Some companies don't track extra time taken as long as employees do not abuse the time and their work is completed. So those are all options for flexible scheduling. A comprehensive lactation program will address all of these requirements, as well as address other aspects to create a supportive environment and ethos, I guess, for their work site. So not only will they address the physical environment and the break time, but they will also create conditions that set a standard of support, such as having supervisors model that, having good communication about all of their benefits, not just the benefits related to worksite lactation, but those that might also affect worksite lactation, like their leave policies, the ability to have gradual return to work after maternity leave, and ensuring that all of their staff at every level are educated about the policies that they have in place, and that the benefits are communicated effectively to staff members. Businesses that go above and beyond minimum standards can receive additional recognition through the Texas Mother Friendly Worksite program. So businesses can receive the silver level or gold level designation. A silver level designation is provided if minimum Mother Friendly Worksite policy standards are met, and the policy includes information about regular communication of that policy, so that the policy is communicated to every new employee within the first 6 months of hire, and communicated at least annually thereafter. To be designated as a silver level Mother Friendly Worksite, businesses currently have to have a dedicated lactation room with a locking door. Again, that's not required to meet the minimum standards, but for silver level, it is required. And in that lactation space, the employer can provide a dedicated pump, a dedicated refrigerator or cooler, a personal cooler to the employee, and or a sink within the lactation space. They also, in order to receive this designation, need to have a written policy for additional flexible scheduling options over and above just being able to flex break time and work time. And some of these options might include having compensated breaks for every lactation break, or having provisions for keeping the baby close during the workday, like baby at work policies, on-site childcare, or work from home options. And if the employer has one of those types of flexible scheduling or options that help mothers be able to work in pumping or breastfeeding more effectively, then they can receive the silver level designation. They also have to provide 3 or more specific types of education or support, such as a lending library, a list of referrals to lactation support, forum, some kind of forum or platform or blog or something for mother-to-mother support or networking between female employees or with other mothers outside of the work setting. Having access to prenatal breastfeeding education classes or return to work classes about breastfeeding for both, male and female employees and their partners. Providing facilities on site or elsewhere for mother-to-mother support groups, providing lactation consultant services, and often that is already provided through a benefits package, so you might already have that in place. If the Worksite lactation support program is coordinated by an international board certified lactation consultant, that would meet these criteria. And also any extension of benefits to the partners of employees. So providing classes for male employees and their partners, or including male partners of female employees in the benefits would qualify you as a silver level mother-friendly worksite. Gold level designation is a little bit above and beyond the silver level. So minimum standards for mother-friendly worksite have to be met again, and the policy has to be regularly communicated, and a dedicated lactation room has to be provided. And currently, under current standards, within that lactation room, there has to be a dedicated pump, a multi-user pump for employees to be able to use, a refrigerator or a personal cooler provided to the employee, a sink within the lactation room, a bulletin board for folks who use the room to be able to communicate with each other, and then a phone where employees can check messages or other things while they're pumping. There also has to be a written policy that supports either paid parental leave of 6 weeks or more, and this is not just FMLA. This is paid leave above and beyond any accrued leave for other purposes. Paid break time and or provisions for keeping baby close during the workday, such as telecommuting, on-site child care, or baby at work programs. And then they need to provide 5 or more educational and support resources, such as a lending library, referrals, the forum for mother-to-mother networking, classes, facilities for support group, lactation consultant services, program coordination, or extension of benefits to partners. So I'm going to provide some examples of how providing these types of benefits can help not only mothers and families in meeting their breastfeeding goals, but help employers in meeting their goals. And these are some examples from companies that have implemented family-friendly flex options. So UPS implemented flexible working schedules such as compressed work week, split shifts, and other flexible scheduling options, and they found their turnover rate dropped from 50% to 6%. Illinois Bell Telephone Company implemented a telecommute option, and they found a 40% increase in productivity. HP implemented compressed workweek option and found a 200% increase in business transactions, and productivity doubled. And IBM implemented workplace flexibility options and found that workers worked more than their allotted time without claiming extra time, and yet they felt that they still had life balance. Aetna implemented 6 months of protected unpaid leave, and then also a part-time return to work option after childbirth, and they found that their attrition dropped by 50%, which saved them more than $1 million per year. The Society for Human Resource Management conducts an employee benefits survey, and they found that 36% of employers implement some kind of comprehensive worksite lactation support program, and 2% of employers have baby at work options. So some other things that can be done in addition to providing these flexible scheduling options and enhanced benefits, family-friendly benefits packages, are to leverage existing resources that are already available to you at no cost, but help to better communicate support to your employees. So one thing that we heard from employees across the state in focus groups, and also from employers who were working on developing these kinds of programs, is that employees have a lot of questions about the policies that apply to them that are already in place, and how to access those policies and the benefits that go along with them. So a very simple thing that can be done is to package information about these policies in a way that's clearly communicated to your employees. So explaining what kinds of leave policies are available, and including the Family Medical Leave Act, how that policy works, and what other leave policies might be available, including short-term disability and other types of unpaid leave protections if an employee doesn't qualify for FMLA. Folks have a lot of questions about these things, and even if they seem clear to the policymakers within a business, often they're not clearly communicated down to the employee level. So having those, again, packaged for employees is a great benefit to them. Also already available to many employers are the benefits that are required now under the Affordable Care Act as part of the Women's Preventive Services component of that. So most health plans now have to provide lactation counseling and breastfeeding equipment at no cost to the subscriber. So one thing that folks who are developing programs can do is call your benefit plan and find out what those benefits are and how they can be accessed by your employees, and ensuring that your health plan at your worksite is meeting recommended standards. And there are resources from the U.S. Breastfeeding Committee and other organizations to help you evaluate what a standard, what standards should be, and also a report card for insurers to see how well they're complying or adhering to recommended standards. And we can share links to those resources along with this webinar. But if having somebody within the worksite investigate some of those issues and then provide information to their employees as part of their employee benefit is really helpful. There are also existing resources within your community that you can tap into. Every WIC local agency, the Women, Infants, and Children's Nutrition program, provides, in every community, there's WIC clinics that provide services to people who qualify based on financial and nutritional need. But they also provide services that are available to the community as a whole. So you can coordinate with your local WIC and find out about what some of those options might be in your community. Many WIC local agencies provide breastfeeding classes to their participants and can open those classes up to other people in the community at no cost. They are a great source for you to get a current list of referrals of lactation support resources in your community. In Austin, the Valley, Houston, and Dallas, there's lactation resource and training centers that provide lactation consultant services at no cost to both WIC participants and non-WIC participants. And so those resources are available in some communities. WIC also has breastfeeding lesson plans that can be used in any setting. There's online classes at texaswic.org that anybody can take. You can sign up for e-newsletters and download a feeding tracker and feeding journal phone app from a website that I'll show you in just a minute, breastmilkcounts.com, and also access the statewide lactation support hotline and resource directory. Some other resources that might be available in your community are baby cafes, which are mother-to-mother support locations with a lactation counselor on site that provide a place for mothers to come together and get support and help with breastfeeding. And there's also likely to be parenting groups and La Leche League groups in your community that you can coordinate with, and if you have enough employees that would be interested in that, you might offer the space in your building to use for those groups to meet, and then your employees can tap into that, or you can refer your employees to these types of groups once you're aware of them. So all of these things can be incorporated at no cost into your existing program. Also, you can link from your intranet to resources like breastmilkcounts.com, which is, it says .org here, but I'm sorry, that's a typo. It's breastmilkcounts.com, and it's I think .org will get you there too, though. It's a one-stop breastfeeding resource that's provided through Texas Department of State Health Services and the Texas WIC program. It's got information here for every stage of lactation for moms and families, including a very robust section for working moms with information for moms to help them be able to combine working and breastfeeding. There are things like downloadable baby announcements or electronic baby announcements here. There's a lullaby CD of Texas artists, and lots of other resources that are available here that you could incorporate into your Worksite lactation support program, and that could help you qualify as a silver or gold level employer. You can also order at no cost to you up to 50 per month publications from the state WIC catalog, and that website's here, and we'll post that as well. And they're excellent materials for every stage of a mother's pregnancy and baby's first year, to help a mother prepare for her hospital experience, those early days of breastfeeding, getting her mother and her partner on board, and returning to work. Something for everybody. There's also materials that you receive when you're designated as a Texas Mother-Friendly Worksite that you can use in your program, such as door hangers, which are downloadable from the website, lactation room posters, and signage and decals. So finally, I want to talk about some steps to take for implementing a comprehensive program of breastfeeding support. And these basic steps will help ensure sustainability and maximize your return on investment. The first step is to seek buy-in, and starting with executive, well, maybe not always starting with, but always obtaining executive level support. So support from the highest levels that's communicated downward is going to ensure the best sustainability for a program and the easiest implementation. It's important to have stakeholders, including your facilities, your policymakers, your human resource folks, management, breastfeeding employees, male employees who are fathers, etc., have a stake in the development of the program. And that's moves into the next step of convening and orienting and engaging a task force, building a team of folks that can help you, help advise you on development of the program, and the policy is going to be very helpful in creating a program that will be effective and sustainable. Once you've gathered that team, conducting a needs assessment will help you ensure that you understand what the lay of the land is in your work site and develop the best possible program. And then once you have assessed your work site, you want to develop a plan and then implement the program components and evaluate the program to make sure that it's getting you what you need. And I'm going to talk a little bit more about each of these steps. So getting input, I've talked about this, but here are some stakeholders that you might engage, including your HR, work life, or employee relations staff. If you have a communications group or public relations group, they're great to have on board. Your facilities, wellness, if you have an occupational nurse or other medical staff, and then I've mentioned most of these other stakeholders already. And then your community stakeholders can also be valuable partners. I've talked a lot about WIC, but here are some other groups that you might engage, including your local breastfeeding coalition, lactation consultants, healthcare providers in your community, and programs like Healthy Start or Nurse Family Partnership are also some good stakeholders. So you'll want to, when you assess needs, you might think about things like how many lactation rooms do you need, how many users might you have, what are options for providing space, time, and support, who will have oversight of the program, who can people come to when they have questions or concerns or need to negotiate gray areas, who will ensure that training, or how will training be provided to your management team, what policies are needed, what things might already exist that you can tap into. And then once you have assessed the needs and the current resources available to you, then use that information to develop a plan that will best meet your business needs and your employee needs. And again, that includes knowing who will coordinate your program. And it's good to have that clearly defined so that as problems or issues come up, if they do, there is a clear path for resolving those. And then, and then when you're implementing your program, or when you're planning your program and thinking about implementation, think not only about the program components that you're going to be implementing, but also how you'll communicate that program to everybody. So to your management team, I talked about training, but also to the potential users of the program, and then more broadly to your community. How can you promote that to folks that you're recruiting into your business, and how might you promote that to other businesses that you interact with, other stakeholders in your business, so that they understand that you are a family-friendly business and are modeling that for your employees. Once you've got the program in place, it's important to evaluate it so that you can ensure that it's doing what you had planned for it to, and this will ensure that you have the greatest return on investment. And evaluation can be very easy from just getting feedback, ongoing feedback from your employees, your supervisors and coworkers, to make sure that you're addressing any issues that come up and making any enhancements that could easily be made to maximize your return. You might also monitor things like cost savings, absenteeism, and turnover rates, etc., to help justify the program on an ongoing basis and grow it as appropriate. There are tools at texasmotherfriendly.org under the Build Your Program tab for each of these stages, from buy-in to assessment to planning to implementing to evaluating. So please take some time to explore those more deeply if this is something you're interested in. So now we're going to take some questions.
Thank you so much, Julie, for a great presentation. Very wonderful. We, as I mentioned at the beginning, we encourage your questions. We've already got a few here, but you can type those into the questions box on your GoToWebinar control panel. So we encourage you to do that, but I'm going to hand it over to Dr. Berg-Williams again to let her moderate here for these questions.
Thank you. One of the questions from Quincy is, on your website, how long does it take for a workplace to be listed as designated, and what else can a business or the local health department do to facilitate the process?
Okay, that's a great question. We have, so typically it would take about 45 days. That is what we aim for. Over the past year and a half or so, we've gone through a lot of changes with the program, including a huge amount of growth. And in order to keep up with that, we have established the relationship now with the UT School of Public Health. And now that they're here, we're getting caught up on applications. We've got quite a backlog, and we do hope to be caught up with those by no later than the end of the calendar year. So if you have applied and are waiting to hear, thank you for your patience. And please know that we are working on it, and you should be hearing from us very soon.
Great, thank you. Sandy asks, do you have any suggestions for mothers who work in booths in the mall and are the only employees? They typically have to close up the booth when they're on breaks.
That's a great question. So I didn't talk a lot about coverage of breaks, and that can be a challenge in a variety of settings. And because there is a law, that is something that an employer does need to figure out a way to address, whether that is having somebody come be a floater, or having a manager come at set times throughout the day to cover that time, or closing the booth down, I mean, would be an option to ensure that the reasonable break time is provided.
Okay.
Well, okay, we will follow up with other questions that we're going to have to end though right now. We appreciate everyone coming on. We did see one that asked if the presentation slides and archive will be available on the website. We will actually send out a link to the archive, including a PDF of today's presentation slides, along with some of the other links that were mentioned today. So you should get a nice bit of information for everyone who registered for the webinar. You can also go to msdcenter.org and click on our webinars tab to go view any of our past Texas Mother Friendly Worksite webinars there as well. And there's one more announcement that Julie has here.
Oh, and we just wanted to let you know that that this webinar has been approved for continuing education for HR certificate from the HR Certification Institute for Recertification Credit. And that's it. So the information is on the screen and will be available along with the materials when they're posted.
Okay, great. Thank you so much. Thank you all for attending. We will get those links to you soon, and have a great rest of the day.